Hey guys, welcome to my channel. Okay, I wanted to do this video in my lab coat, but then when I was packing up my stuff for the break, I did not pack my lab coat because I was gonna use it. Turns out I was gonna use it. I should have packed it. It would have been so perfect. Cause I feel like my perspective is kind of going to come from a medical standpoint, and I am a medical student, so why not? The fuck. But at the same time, and it doesn't have my university's logo on there. Therefore, it's okay for me to have worn that lab coat, because at the end of the day, I want to make clear, what I want to say in this video is not affiliated with my university. I should probably introduce myself first. My name is Sandra. I go to the University of Ghana. I almost said University of Iowa. Well, I go to the University of Ghana. I'm a med student and I am in the GEMP program. If you want to know about GEMP, you should check out my video about the GEMP program here at University of Ghana. Also, I'm going to be looking down a lot, and it's because this is such a heavy topic. I need like all my facts. Like guys, I wrote notes on this. That's how much I prepared for this, because I'm very passionate about this. Hence my notes. Like I have an actual book written down, like stuff written down. Anyway, so I'm going to go in order of it. I'll try not to look down too much, but like I said, this is a lot. It's a lot we're going to uncover in this video, okay? So, I've always seen stories online about fatphobic doctors, and not just doctors, but other people in the healthcare field. And I want to talk about doctors specifically because I want to be one. I am studying to be one. And because at the end of the day, as doctors, our duty is to actually advocate for our patients without prejudice. Right? The aim of this video is to correct misconceptions, to make people aware of what fatphobia is, and for us to help other people like me become better health professionals. I don't know, maybe it sounds lame, but yeah, I'm very passionate about this. So the intended audience is med students, students of other healthcare professional fields, already practicing health workers, already practicing doctors, fat identifying people, such as myself. So not only am I a med student, but I'm also someone who identifies as fat, and honestly anyone who cares about equality. And of course my family and friends who are here to support me, because I forced them to watch this video, thank you. Okay, so, disclaimer. I'm not encouraging obesity. Let's start with that. Honestly, I don't know whether I should leave the comments open for this video, because I feel like with the kind of world that we live in, if you make any comment that's to say that you should leave fat people alone to live their lives, people are like, oh, you're supporting obesity. And it's like, no. I can advocate for fat people's health without supporting obesity. And I can advocate for their rights without supporting obesity, okay? Cool. Anyway, so that's my main disclaimer. I hope I have a mature audience right now that's listening to this, that gets where I'm coming from when I make this video, okay? I'm only a med student. So whatever we're going to talk about in this video, some of it is going to be with application of some of what I've learned. Number one. Number two, the reason I'm also saying that I'm a med student is to say that some of what I'm going to say is, so like I said, my target audience is fellow med students, people in other healthcare fields, and also like actual practicing doctors. I don't want this to be taken as if because at the end of the day, anyone who is a practicing doctor, or even someone who is just a year above of me, is technically someone who I can learn from. He's technically my senior in experience in the field. And so I don't want it to be taken as some disrespect towards them, but I feel like this is something that I'm passionate about, and I feel at the end of the day, medical fatphobia is wrong. Alright, so let's start with what fatphobia is. Let's define it. Fatphobia, when I googled it, it's described as the fear and dislike of fat people. Okay? It's a problem because it leads to discrimination of obese and fat individuals. Now, there's also this term called medical fatphobia, and it's basically how fat people are treated in the healthcare system. Like I said before, when I would go online, especially like on Twitter, I love Twitter, oh my gosh, I love it. I've actually suffered a lot from Twitter, but I love it, I love that site. I feel like, anyways, not the point, it educates me a lot, but yeah, that's the point. When I go online, like on Twitter, I see stories, I see people sharing their stories of what their experience has been like in healthcare, especially fat people, but also slim individuals, like really underweight individuals as well, and what their experiences in healthcare are like. But I'm going to focus on the ones that affect fat people because they're the ones who are more discriminated against. It's just a fact. Like, don't fight me. Let's not even go into that. Okay, so, fat people go to the hospital and they'll give like healthcare workers, doctors for example, their symptoms, and they'll describe what's been happening to them. And then doctors will be like, oh, you know, if you lost weight, you know, then you would feel better. Those things would go away. Patient could be anemic. I've read stories where patients have had cancer and the doctor's like, oh, you know, if you lost a little weight, you know, that would go away. But there's patients, some of the stories that I'm reading, they've been more serious diseases and conditions. And yet, we as professionals, we've all been trained not to be prejudiced and actually look through and investigate. I'm not doing that part. And so that's very worrying to me. Another thing, I also read about this study that was done on med students at Wake Forest, And this one I have to read because it has like statistics in it. A study was done on Wake Forest School of Medicine third year medical students. And this study showed that over a third of med students had significant implicit weight bias for both fat and thin people. And of that class, 39% had anti-fat bias, 17% had anti-thin bias. They did this test using the weight implicit association test. So I just don't understand how, as people who are learning to advocate for our patients, we're also biased against them. I think that's why I feel like it's important. I'm actually going to share this with my classmates. I'll see what the reaction is. But part of the reason why I'm bringing this up is because I feel like as people who are supposed to be advocating for them, we should be the ones least biased towards them, because bias will prevent you from seeing the actual issue with the person. If a patient comes to you and you have bias towards whether they're fat or thin, you having that bias is going to come in the way of your work, in the way of you doing your job, which is to basically diagnose the patient and help them and treat them, or manage whatever condition if it can't be treated. And yeah, so I'm just going to leave the links and the links for any of these articles that I'm going to be talking about in this video in the description box, so that you guys can go look. Like, you'll see where my sources are coming from, and also there's going to be one major article that I'm going to talk about in this video that actually this one has been circulating quite a bit. I feel like most people who are fat identifying or support fat people and like understand the importance of speaking against fat phobia, most people who are under those two things have actually already read this article. But I'm going to put the links for everything in the description box. So before we go any further, I wanted to talk about something specifically. So I identify as fat, as I already said, and I can understand if people might feel like that's going to make me biased or that this is a personal issue. It is. It is, not gonna lie, because so I started identifying as fat when I was 18. That was when, I think I was a freshman. Yeah, I think I was a freshman in uni. That's when I started identifying as fat. And I've been gaining weight for some time. Like, I used to be a really skinny kid, like really skinny, and then it wasn't until I hit puberty, like when I was 12 or 13, and we'd actually moved to Kenya and started school at Braeburn. That's when I started like putting on weight. But it wasn't until I was 18 that I was like, okay, Sandra, we're fat. And personally, I don't think that's a bad thing. I think fat is can't speak today. Fat is just a descriptive word. That's how I look at it. To me, it doesn't mean that I'm more beautiful or that I'm less beautiful. That's literally it. It's just a descriptive word. Like how you can describe someone as slim, black, whatever. It's just a descriptive word. But I also understand fat people or bigger people who do not like using that word, and I respect it for them. But personally, in this video, I'm going to keep using it towards myself, not because I think it's a bad word, but because it's just a descriptive word. So it's clear, just because I identify as that doesn't mean I don't think I'm worthy or that I don't think I'm beautiful. I do understand that diet and weight contribute a lot to a lot of metabolic disorders. I get that. I understand metabolic X syndrome. I really do. I get that. However, it's not isolated to weight and diet. It really isn't. There's a whole lot of other factors, genetic factors, all those things. And so to me, it amazes me that we're aware of these things and yet we still stereotype and we stay stuck on weight when our patients come in. Before I continue, a lot of what I'm going to be talking about in this video is stuff that I also read from this article that I was saying before, the one that basically everyone who identifies as fat or is very, very, very active on social media or just reads a lot in general. Anyways, lots of people know about this article. Everything you know about obesity is wrong. It's by Michael Hobbs. Oh my god, when I was reading that article, I cried. I actually cried because just reading all these stories made me so sad about, like, it just made me so sad because the way these people have been treated by the healthcare system is so unjust and just so unfair. Lord knows I hate unfairness. I just hate when people are treated unfairly. I hate it. From that article, I got this statistic, right? And it says, between a third and 3/4 of clinically obese people are metabolically healthy. Don't look so surprised. This means that these people have normal cholesterol levels, they have no signs of elevated blood pressure, and they don't have insulin resistance either. So, however, a quarter of non-overweight people, or normal and underweight people, are what epidemiologists call the lean unhealthy. A quarter of the so-called healthy-looking people are what the epidemiologists call the lean unhealthy. Remember that term I brought up, medical stereotyping? So basically, doctors just assume that according to your BMI, you must have a metabolic disorder, right? Like hyperlipidemia or diabetes. They're just making these assumptions. And they're not looking further to investigate the reasons why patients are coming in with symptoms that they're coming in with. And before anyone says that I'm just making up these things, again, please read that article. Link is down in the description box. Feel free. I mentioned BMI. Basically, for those of you who don't know, though I feel like almost everyone knows this, BMI is weight, actually, according to physics, it's mass. Weight divided by height squared. So that's going weight in kilograms divided by your height in meters, and then square the meters. So that's how you get your BMI, right? But most of them are like, oh, if you're obese, because obese starts from above 30, right? So most of them say if your BMI is above 30, then they're just going to assume your exercise and your diet are poor, and therefore that you're going to have lots of metabolic disorders, which it does contribute. It does. Do not get me wrong. But the fact is, BMI alone as a measure is very inaccurate. I mean, athletes, for example, like especially the heavyweight, like the weightlifters, right? They have high BMIs, but at the end of the day, BMI alone is so inaccurate in terms of assessing whether a patient is going to be unhealthy. For adults, it's especially important to couple BMI to their waist-hip ratio, their vitals, like their blood pressures, to keep a consistent check on their blood pressures. Because obviously sometimes, maybe due to, I don't know, because they're in the hospital it's higher, but like a consistently high, consistently normal blood pressures, to couple it to their lipid profiles. Looking at their lipid profiles will help tell you, again, if this patient is unhealthy, instead of just looking at their size and assuming they are. Like even bioimpedance, which is when they look at your percentage of body fat. Why not use all these things together instead of just looking at someone's size and assuming that this person is unhealthy and not giving them the proper treatment? It's crazy to me. Anyway, I'm so grateful that my results have always been normal. Cholesterol, they even go as far as to check like my liver enzymes, all that stuff. And I've always been normal. And yet I am actually in class 1 obesity. Like that's, my BMI falls under that. And I've always had normal blood pressures. I've always had normal heart rate, like all my values are normal. But then people just find, like people are just so excited to be like, oh, this person's bigger than, than the normal, than the average that we want, therefore they must have this, and that's crazy to me. And don't get me wrong, I understand that where one grows up, their culture, like basically that society around us affects how we view people. I get that. And so depending on where you've grown up, there's a lot of unlearning you have to do when it comes to approaching patients. I get that, whether it's their religion, how they speak, where they're from, all that stuff. But I feel like we're definitely less there than we are with weight. And by not unlearning our biases, we each have our individual biases. I'm still unlearning mine. And so when you haven't unlearned your individual biases towards people's differences, then you're likely to not give the perfect healthcare that you can give to a patient. And I'll even read more examples from that article I was saying before. It said that 14% of OBGYNs in South Florida barred new patients that weighed more than 200 pounds, which is 91 kgs. So they barred patients that weighed more than 91 kgs. 14%. Guys, when I read this, I was like, so you're telling me if a patient, if you're the closest OBGYN to this patient, they have to go further out of their way just so they can get healthcare because of your bias. Because of your bias? Are you kidding me? Like this is crazy to me. 14%, that's high. Not like, oh, 1%, that's 14. I just don't understand why up to now we don't get this. Shaming patients is not the way to help them lose weight. So before anyone brings that up as a competent reason why medical shaming should keep existing, one thing needs to be clear. Shaming patients is not what's going to help them lose weight. Ever. Shaming someone has never helped them. It just makes them beat themselves up harder and it just, like in a way, encourages them to just keep doing the destructive things that they want to do. And not only that, but shaming patients will make them less likely to come to the hospital. These are the same patients who, let's say, when they come in and they have like a late stage disease, you'll be like, oh, why didn't you come earlier? Why didn't you come earlier? And yet all the times they've come to the hospital, like doctors and other healthcare professionals have shamed them. How is that going to encourage your patients to come seek you early? Another thing that pissed me off that I was reading from that article, I'm so grateful that Mike Hobbs wrote this, because I feel like a man, especially one who is not fat, writing an article about why the way we're going about approaching obesity is wrong, I feel like more people listen compared to when fat people speak about it, especially fat women speak about it. Anyways, another thing that I saw from his article, that fat patients that seek therapy spend half of that session discussing their issues with healthcare and the other half their issues with the rest of the world. That is so crazy to me, because that just shows how, as people in the healthcare field, we're affecting people's mental health. And at the end of the day, if we claim to care about their health, we should be going about our work without affecting their mental health. And at the end of the day, people's mental health affects their physical health. So as a whole, shaming is not helping them become healthy. It's making them unhealthy. I have examples for you guys, okay? It's still from that article. So, this patient goes to the doctor to have an ovarian cyst removed, to the gynecologist. And the doctor points to the MRI and says, look at that skinny woman in there trying to get out. Patient's name in the article is Emily. So she says to the interviewer that after that incident, I was worried I had cancer, and yet she was turning it into a teachable moment about my weight. Guys, my heart, when I was reading this article, oh my god. Like, I told you I cried, yeah? It's because the reigning theme of that article was that these doctors felt that fat people did not deserve their basic humanity, their basic decency, and all the things that they teach you as medicines in how to talk to your patients. It's like they felt like their fat patients did not deserve that. The sad thing is they put it under the guise of, oh, we're helping them get healthy. One thing should be clear, there is no person on this earth who is fat identifying that is not aware of the risk factors that we face. We literally see it everywhere. People who've never gone to med school tell us, anywhere on the internet. People who are doing crack and all these other drugs tell us. They tell fat people how they're at risk for any metabolic disorder, whether it's diabetes, dyslipidemia, or coronary artery disease, strokes, everything. They tell us. So people are aware. So I have a second example for you, okay? The patient's called Carissa Enneking in the article anyway. She smokes, she starves herself. Some days and others only, she lets herself have a cup of yogurt and 3 Ritz crackers or a granola bar all day. That's it. Her mother took her to the doctor and said that her daughter was sick and was not eating. She had starved for 6 months, but still wore plus-size clothes. Enneking told her doctor that she had traded solids for liquids, food for sleep, and she was hungry all the time, but she was learning to like it. Note that. When she ate, she had panic attacks. The doctor tells her, well, whatever it is you're doing now is working. He told her to keep it up, and that when she was small enough, her body would start processing food differently. Then she could add a few hundred calories to her diet, and then her period would start to come back. Okay, so first of all, the term for that when the period stops coming is amenorrhea. If you have amenorrhea, that means your hormones are out of whack, like your luteinizing hormone, for example, is down. And to me, it's crazy that there's doctors out there that are encouraging their patients, like this doctor, not to eat, like to keep not eating, when it's clear that your patient's hormones are out of whack. How fucked is that? Anyway, Enneking, the patient, says that if you looked at anything other than my weight, I had an eating disorder. And yet here my doctor was congratulating me. Honestly, that's the other thing. I feel like people don't understand that there's obese people out there who actually have mental illnesses. But the fact is, when fat people have mental illnesses, they're ignored because compared to slim people. And it goes back to also how when slim people have eating disorders, they get the attention, they get the proper health care, like they're put into like rehab for them to get back to their normal selves. Whereas the fat people, they're ignored because it's like, you should lose weight, you should lose weight. There's never a point where whether you're fat, you should stop eating, ever. There's no point where it's healthy, at all. And anyone that says that it's bullshit. No point. It stated that to get into treatment centers for eating disorders, thin women had to wait only 3 years, within 3 years, whereas for fat people it took them 13.5 years. Again, this relates to their health. But guess what? We treat them differently and we discriminate against fat people just because they're fat. Medical fatphobia. Personally, I believe that the body positivity movement, I brought it up. I personally believe that the body positivity movement is actually doing more for obese people and fat people in regards to their health and even weight loss than fat shaming is, than medical shaming is. I said medical shaming, not medical advice. I do not want anyone to misconstrue what I am saying. I'm not saying that as doctors, that doctors should not be able to advise their patients, but you have to make sure that the way you're going about it is actually right, because at the end of the day, you have to make sure what you're doing is not medical shaming and that it's actually giving them the advice that you're supposed to. Another thing, do you know why bariatric surgery exists? It's because literally, I think for 34 years, there's been no country at all that has been able to lower its obesity rates. Obesity rates are rising. So for me, the way I see it, in 34 years, if medical shaming was working, then why haven't these rates gone down? Clearly, we're going the wrong way about this. If it was working, then those rates would go down. And if something's not working and you keep doing it, isn't that the definition of insanity? That fact was stated in that article, and I was so shocked. I even googled it to see if there were other places that was stating it, and it's true. In 34 years, no country has been able to lower its obesity rate. So clearly the way we're going about it is wrong. That's part of the reason why I'm doing this. Back to my point about bariatric surgery. The reason it exists, number one, the obesity rates are not going down. Number two, statistics say that the chance of an obese person losing weight is 0.8%. Yikes. This is all from that article. Statistics also say that when one loses 3% of their weight, they experience a 17% reduction in metabolism. 17%! Meaning the more you lose, the harder it is to fight the weight off. This is exactly why dieting fails. So that's why most morbidly obese people are able to lose weight through bariatric surgery. And the reason I'm stating this is that we can have some empathy and understanding for obese patients. So the reason I made this video is not to, oh guys, we need to stop doing this, doctors are trash, because I'm trying to be one, and obviously I don't think that all doctors are trash, duh. But it's also just so I know, like, I'm this little ant in this, world of people who are trying to do better, and I think that these are ways that we can do better as people who are in the healthcare field. And the first one is to take training seriously. This is what I mean. So I remember when I was a nursing assistant in the University of Iowa hospitals and clinics. Hi, UIHC. But we were given training for basically how to treat patients who are different from us. Like, I know it sounds lame. So whether it's how you would talk to an elderly patient, how you would talk to a patient of different race, different religion, obese patients, we had we were given actual training. And this was done so that we can leave our biases behind. I don't know if this training is given to medical students, I think it is. It's important that it is. I'm still doing so I'm about to go into my 3rd semester. I don't know, I'll be starting clinicals in October. I can't wait! Actually, I'm very scared. That's a lie. I'm very, very scared. I'm very, very scared. Honestly, it feels like as if I'm an imposter in this, in med school. But anyways, the point is, back to the training thing. So that's why I don't know if we're given this training. I will ask people who are ahead of me if we are. But either way, if we're given that training, I think we should take it seriously. So that's one way. And the other thing is to actually discuss what your patient should eat. So lots of patients talk about how their doctors just say, just eat low-fat diets, just, diets, low-fat diets, that's it. But the fact is, if you take time to find out what your patient enjoys, how what they eat is affected by their culture, where they live, socioeconomic factors, because obviously that plays a role in what they're able to buy, and also teach them the importance of nutrients over calories. Like, just going about this in a constructive way is what I'm hoping for. And then to my fact identifying people, when you go to the doctor, you need to advocate for yourself. I heavily believe in advocating for yourself. Anyone that knows me knows I'm always like, hence this video, duh. But the fact is, when you go to the doctor, you have to speak up for yourself. If you feel like they're making diagnoses off of stereotypes, then demand tests. They have to. The fact is, doctors are imperfect human beings. I mean, unfortunately, in my culture, we look at them as these people who are close to gods, and that's something that honestly I find really frustrating and really annoying. But at the end of the day, we have to stop doing that and advocate for ourselves. It's your health. If you don't advocate for it, who will? Regardless of whether they make mean comments like, oh, you're close to death, sweetheart, you should still be comfortable in your chubby skin. To my fat identifying people, don't forget that just because you're clinically obese, that you're beautiful, and that you're sexy, you're worthy, you're thick. Despite all the negative mean comments people make, at the end of the day, you should still be comfortable in your chubby skin. Be confident. Like, honestly, I personally feel like you should be able to honor the body that you're given, because at the end of the day, it's what gets you through your goals. It's literally what you're housed in on this earth. So treasure it, treat it right. Before I close out in the video, I just want to make it clear. I'm going to give the disclaimers again, okay? So I'm a med student, but what I've said in this video is not affiliated with my university. So do not blame University of Ghana if you have a problem with this message. Yes, I have applied some of the knowledge that I've learned from them, but it's also to do with research that I've made, with my opinion, my experiences, and honestly, just common sense. Secondly, I am not encouraging obesity, okay? I do understand the risk factors that come with being obese, I do. And honestly, so does every obese person. I do want obesity rates to go down, because at the end of the day, risk factors, right? However, I want it done in a healthy, in a wise manner, in one that's going to be productive, so that we can improve on the quality of life and lower mortality. And lastly, if I decide to leave the comment section open for this video, if you do decide to comment, do it politely, respectfully, even if we have differing opinions. I'll reply to you so that we can have, a debate about it if we need to, but just be respectful, people.